I'm Kathryn Mobley, Special Projects Producer at WCSUFM 88.9 Jazzy, part of Central State University, an 1890 land-grant institution. You've joined us for a segment of our nationally sponsored Save a Life campaign, a year-long project featuring stories about the impact of COVID-19 on African Americans and other minority groups. WCSUFM and about 24 other HBCU radio stations across the country are participating in this educational initiative funded by the Corporation for Public Broadcasting. According to the American Cancer Society, African American women have a higher incidence of breast cancer than their white counterparts, and 40% of these Black women are more likely to die. Recently, the Dayton area chapter of the American Cancer Society hosted the Making Strides Against Breast Cancer charity walk at Island Park in Dayton, Ohio. That's where I met 43-year-old Keisha Straight, a Dayton native. She's also a stage 3 metastatic breast cancer survivor.
I'm a registered nurse, so I kind of knew already.
In August 2019, a mammogram revealed a lump in Keisha's left breast. However, she says she actually found it 8 months earlier during a self-exam.
But I was kind of in denial or didn't think it would kind of happen to me because we didn't have a family history.
As cancer continued invading her lymph nodes, Keisha faced another frightening reality in mid-March 2020. Hospitals shutting down scheduled surgeries because of the COVID-19 pandemic. Her oncologist strongly advocated on her behalf. And finally, on March 17, 2020, Keisha checked into the hospital to get her left breast removed.
And they asked that the ride drop you off at the door, that only you come in by yourself. And they immediately asked you the COVID questions. And then they proceeded to do the temperature. And once they took you in the triage room, they did a rapid COVID test before they even proceeded with any of the triage. And I had to have a test a couple days before the surgery as well.
The pandemic also impacted Keisha's recovery. Several hours after her surgery, she was told she had to leave the hospital and recover at home.
I was just outdone because, like I said, the same day, I was thinking about going home, recovering the same day afterwards, and I have a 9-year-old, and that's when they said schools was going virtual. I was thinking I can't take pain medicine, I can't sleep, and I don't even have time to be sick.
Keisha's oncologist discouraged her from resuming her nursing duties. Increasing numbers of COVID-infected patients were filling beds in the hospitals. Meanwhile, the cancer and chemotherapy severely compromised Keisha's immune system, making her extremely vulnerable to contracting the virus. Still, she needed help.
And of course, disability said basically I wasn't sick enough. Eventually, I got medicated. The hospital ended up paying for me to get COBRA because my chemo was like $39,000. When I had regular insurance, United Healthcare, I had conventional IV chemo. But when they wanted to put me on Medicaid, they wanted me to switch to the pill. So I said, so you got one set of health care for working Americans and one set for Medicaid. I said, I'm not going to change my treatment. I'm going to continue to get what I've been getting. You can't tell me how much or how effective this pill is. It was a struggle going back and forth with the barriers and trying to get down to apply for public assistance, to get documentation, income verification. A lot of places was closed. Didn't have a printer at home. Needed to go to the library was closed. Had to make an appointment. You had to turn verification in within 10 days. However, everything was closed, so you couldn't get the information they need, couldn't get nobody on the phone. So you leave a message, wait for them to call you back, and when you try to go in person, you couldn't come unless you had an appointment.
Through it all, Keisha says she never lost her faith in God, who provided for all of her needs and some of her wants.
I'm doing great overall. I had complications with my tamoxifen, the medicine they put me on for the breast cancer. It actually almost killed me. So just adjusting with trying to be put into menopause.
This experience also inspired her to write a book, Finding Joy in the Journey, a coloring and activity book for breast cancer survivors.
It helps you relax. It reminds you to have self-care bingo in it. It has color and it has positive affirmations for you. Tic-tac-toe, Sudoku, anything. And then you get chemo brain. So I even included an answer key in the back for that.
What is chemo brain?
Brain fogginess or forgetfulness associated with receiving chemotherapy.
The cover features a regal brown-skinned woman crowned in a brilliant pink turban. An ornate gold necklace flatters her neck, and she has no breast.
Though you don't have breasts, you can still be attractive. I wanted to represent somebody that looks like me. I see a lot of books on the market and coloring books, but when I go in gift shops at the hospital, I don't see anything representative of us.
Keisha is celebrating 1 year of being cancer-free. She's completed her treatment and has resumed working as a registered nurse in an addiction recovery hospital in Indianapolis, Indiana. She's also in physical therapy to help increase the mobility of her left arm. Keisha strongly urges all Black women to get routine mammograms and to be proactive when they see or feel any changes in their body.
I was working agency and didn't have insurance. So I said, when I get insurance, I'll go to the doctor. And I tried to self-diagnose because then when I went to the doctor, that it had spread to my lymph node. So I'm thinking those 8 months that I waited, 10 months, it probably wouldn't have been as severe because it had spread. I had 3 different areas. Could have had a lumpectomy instead of a mastectomy. Had just that area taken out, so I probably made it worse.
Learn more about Keisha's book at jotthejourney.com. I'm Kathryn Mobley, Special Projects Producer at WCSUFM. We're participating in the Save a Life campaign, a year-long educational initiative featuring stories about the impact of COVID-19 on African Americans and other minorities. WCSU-FM and other HBCU radio stations across the country are bringing you these stories. This national project is funded by the Corporation for Public Broadcasting. Also, get updates about the coronavirus in Ohio. Go to coronavirus.ohio.gov. You're listening to WCSU-FM 88.9 Jazzy, part of Central State University, an 1890 land-grant institution.